Hey folks, Blair from Nose Creek Sport Physiotherapy, where we get you moving faster and feeling better. Today's topic of the day is foot pain. So what I'm going to go through today is basically some stretches that I give to all my patients in the first couple of sessions when they're coming in. All my orthotic patients, we prescribe orthotics to as well. While we're waiting for their orthotic, we're getting them to really get the flexibility back and what we call the posterior chain, kind of the back of the leg and the sole of the foot, okay? And then we'll go through some simple arch strengthening exercises as well. So we'll get into stretches first. So the first one is called calf stretch. So to do that, you're going to put both hands on the wall, one foot forward, one back. The back foot, you want to have the knee locked straight, okay? But you're going to toe in your foot towards your opposite heel. So your toe should be pointing in this way a little bit. You're simply going to lock the knee and just lean forwards into the wall. So you get a strong stretch in the top half of your lower leg. So right in that calf muscle there. All stretches should be held for about 20 to 30 seconds. And my rule is if it's tight, you do it twice. And within about 2 to 3 weeks, it won't be tight anymore. So then you just do it once, okay? So that was the calf stretch. Now the next stretch down the chain is what we call the Achilles stretch. So same position, like we're back here with the locked straight knee. Now we're gonna come a bit closer. We're gonna bend both knees down. We're gonna kind of sit on that back heel. By sitting on that back heel, now we're getting more of a focus stretch in a muscle called soleus, which is the powerhouse muscle that kind of lifts us up on the balls of our feet. And you'll feel it kind of in the tendon area. So that's kind of soleus and the Achilles tendon. Okay, and again, hold for 20 to 30 seconds, repeat twice if tight, okay? The next one is we're gonna put our foot up on the wall, and we're gonna just gently have our toes resting on the wall. We're gonna take our knee lightly towards the wall so we feel a bit more of a stretch in the Achilles tendon as well as the arch of the foot. And that just lengthens out our plantar fascia and all the tight muscles and intrinsic muscles in the arch of the foot, okay? And so again, just be careful not to jam the knee in because you could hurt your small toe joints there. Okay, so those are the 3 stretches that I need you working on to release the sole of the foot and that posterior chain of the lower leg, okay? Certainly doing hamstrings as well, laying down on your back, straightening your knee out to lengthen out your hamstrings would be helpful as well because that would be part of that posterior chain, okay? And then the next thing is strengthening the arch. So to strengthen your arch, quite often if you're in pain when you first come in for the first 2 weeks in therapy, we'll actually sit you in a chair, put a towel on the floor, and we tell you to do this twice a day, so at breakfast time and supper time, and you're basically gonna scrunch the towel up underneath your arch until you can't scrunch anymore, then you lift your feet up and then you make another pile with the towel with your feet. After 2 weeks, you'll probably find that that's pretty easy. You can go to the end of the towel and back, sort of 3 times is our standard, or until you feel fatigued. Then in 2 weeks' time, when the pain in the foot starts to drop off a little bit, what we want you to do is to do it in standing. So you're actually gonna stand up, you're gonna lift all your toes up, okay? And you're gonna slowly come 4, 5, 3, 2, 1. So from outside to inside. And as you drop your toes down, 4, 5, 3, 2, 1, what will happen is you'll start to feel a contraction in the arch of your foot, and then you actively pucker your foot a little bit more and then hold that contraction for a good 10 seconds and then relax and let it go, okay? That one we usually prescribe to doing 10 in a row, so 10 times, but 3 times a day if you can. So kind of once in the morning, once in the afternoon, once evening. And there's no excuses. Anytime you're at the grocery store, standing line at the bank, anytime you're standing in line, you can just lift those toes up. And again, 5, 4, 3, 2, 1, outside to inside, and then pucker that arch, hold for 10 seconds, relax for 10. Heck, people won't even know you're doing arch exercises while you're standing in line there. So those are the 2 kind of arch exercises, the beginner one on the towel, the more advanced one in standing, and then the 3 stretches. Again, just to review the calf, Achilles, and then the arch stretch, okay? So really work on getting that flexibility back in the posterior chain, as well as a little bit of increased tone in the arch of your foot, and I guarantee that'll go a long way in reducing your foot pain. And if after doing these stretches for a couple weeks, you're still having some concerns, then definitely grab the phone, give us a call, we'll have a closer look at what we need to do. There could be the possibility that we need to address some other modifiable risk factors like mechanical movement within your feet. The foot is made up of 26 bones, so we gotta make sure all those 26 bones are working together as a team. We can look at your strength in the muscles that basically have tendons that run over your ankle into your foot and work on some ankle tubing. We can also work on your balance, making sure you have good static balance as well as dynamic balance. And we do that with a series of tools we have in our office. So sometimes just the basic stretches can give you relief, but they don't solve the whole problem. So there's usually more pieces of the puzzle we have to put together. And for those of you over 40, we all need these things called reading glasses. I strongly believe that after age 40, the arches of our feet are starting to basically wear and sort of our arch is starting to flatten out. So as the ligaments lengthen, we're getting lengthening of our arch, and we'll also get widening of our foot as well. People often say to me, my older patients say, I think my foot is growing, Blair. The reality is it's not growing, it's just flattening out. So we're kind of losing out to gravity, okay? So we have two major arches in our foot. There's the medial longitudinal arch, which is on the inside of your foot here. Okay, and then we have a transverse arch that basically goes across our foot underneath our knuckle joints. And typically by age 40, that transverse arch is completely flat. And that's how we tend to get kind of hammered toes, where our toes start to curl up a little bit. So these are things that we can notice structurally, but we can still mobilize at that age of 40 to 50 and really get some significant changes in the way the foot works. As we get into our 6th, 7th, and 8th decade of life, it just gets a little bit harder, but the orthotics and the rehab can definitely make a difference in your foot pain. And really, the feet are the garbage cans of your legs. And I mean that in a passionate way, in that if you have a problem in your hip, your back, or your knee, if it's stiff, it's gonna put more pressure on your poor feet, and your poor feet are compensating for that, that stiffness in the knee or the hip. So you should definitely get that looked at to keep your feet happy, because if you have happy feet, you're gonna be more active. If you're more active, you're healthy. All right, so that's the foot section for today. I hope you enjoyed that information. Keep stretching, and I'll talk to you soon. Take care, bye-bye.